the heart starts beating in the mother's womb in very early in pregnancy, and it continues to beat till the very end. Now, if somebody wants to know what is a healthy heart, when we come in this world, our heart is in, nature has made our heart in a perfect shape and function. But as the age advances and our lifestyle changes, then gradually there are certain changes in the heart and the blood supply to the heart that further leads to heart disease. Then the question arises that how should we keep our heart healthy? What exactly is the heart disease that we speak of so much these days? It is observed that in Indian population and people from Indian subcontinent, heart disease is genetically, we have got a genetic makeup that we've got a lot of patients who have got heart disease or who are prone to get heart disease. It is also true that people from Indian origin have got more chances of developing diabetes mellitus. Diabetes, that is the disease where the blood sugar levels are high, is one of the prominent risk factors leading to heart attack or heart, which is in common parlance is known as heart attack. You may ask, what is a heart attack? Heart attack is that gradually over the period of time, when the blood supply, the blood vessels of the heart, they get clogged due to deposition of cholesterol, and gradually the opening, the channels of the heart, they become clogged and narrowed. So when the demand of blood is more, the supply cannot be met due to blockage. That leads to chest discomfort, especially on exertion, and that is known as angina. When the patient rests, the pain disappears because the demand of blood is less. When he exerts, the pain becomes more. As the disease gradually progresses, then it further leads to total blockage of the artery of the heart which supplies blood to the heart, and that leads to severe chest pain called as heart attack, or we call it myocardial infarction. How to identify that it is a myocardial infarction or a serious problem like a heart attack? The pain is typical. The patient has never experienced such pain earlier. It is very severe in intensity in the front of the chest, and it travels to the arm, neck or upper abdomen. It is associated with sweating, vomiting, nausea and weakness. And it remains for some time, even at rest, and for more than half an hour. If such pain persists, the person has to report to the hospital any time of the day or night, rather than wasting time at home and trying various other home remedies. What do we offer if the patient comes in the golden hour or the early stages of the heart attack? If we check and find that the patient has got a heart attack, and we immediately, if the center is enabled to do an angiography, we do an angiography, check the blockage, and if it is totally blocked, we open that artery and put a metal stent that restores the blood flow and reduces the damage to the heart muscle. If a center does not have the facility for stenting and angiography in emergency, then there are blood thinner injections available, what are called as the clot busters. If the patient reaches the hospital at a good time, that is up to 6 hours, then we can give clot buster injections that dissolve the clot and again restore the blood supply to the heart muscle and reduce the area of heart attack. It is also observed that many times patients do not, in India especially and in Indian and neighboring countries, patients neglect the symptoms and deny the symptoms and reach the hospital much later. Even patients having angina do not consult the doctor and think that it is muscular pain. And when they do so, the disease gradually spreads and involves lot of areas of the arteries of the heart, and sometimes it becomes inoperable. Even bypass surgery cannot be done because the disease has become extensively spread in the heart. It's not always that the chest pain is due to heart attack. There can be various other reasons, like a patient can have a rupture or a tear in the major vessel of the heart body which arises from the heart, which is called as aortic dissection. It also presents with the chest pain, but the pain is typically different. The ECG does not show evidence of heart attack, and etc. So the management of such patients is entirely different. Similarly, anterior chest pain can be due to food pipe acidity and reflux of acid into the chest. It can also be due to pneumonia or pleurisy or pleuritic chest pain, and it can also be due to muscular. But who is the person to know best? The doctor, because out of all these things, heart attack is life-threatening while other conditions are not. Aortic dissection is also one condition which can be life-threatening. So it is best to go to the nearby medical facility, at least get an ECG done and know from the doctor whether it's a heart disease, heart attack or something else. If a person has been diagnosed as having heart disease, then there are various risk factors that it is best to prevent development of heart disease. And how do we do it? It is by preventing certain risk factors which make you prone to get a heart attack. What are these? So, number 1, uncontrolled high blood pressure. Number 2, diabetes mellitus. Number 3, smoking. Smoking is not fashionable. Apart from heart disease, it leads to many other life-threatening conditions, including lung cancer. Then comes obesity and lack of physical exercise. Also, high cholesterol, which we call as dyslipidemia, is also major contributor, apart from genetic condition, as I told you in the beginning. These factors are modifiable in the form that if we check our blood pressure, take the medicines regularly if we have got high blood pressure, keep our blood sugar well under control, detect diabetes early, control our cholesterol and lipids, eat a healthy diet, balanced diet, a traditional Indian diet which should not contain too much of fats and carbohydrates, should include a lot of green leafy vegetables, fruits and sprouted vegetables, and high fiber diet and fruits. That should be included in our diet. Oil, saturated oil, the one that gets frozen in winter, should not be taken. What should be taken is various kinds of oils like rice bran oil, soya bean oil, mustard oil also in small quantity. These days it's very fashionable to take olive oil, but in Indian context, if we cook olive oil in the Indian style, then it loses all its good properties. What comes next is the dry fruits. Some of them like walnuts and almonds are also good for heart, but mind you, nothing in excess. It should be a balanced diet. Also, flax seeds are good for reducing cholesterol. Whole eggs in restriction, 2 to 3 eggs, and also red meat is to be avoided. And the way that we cook should also be less deep fried food. Exercise should be part of our life, and it should be considered every day is the best, otherwise at least 3 times a week for half an hour. Also, we should try to achieve the ideal body weight. Deposition of fat in the waist is considered to be directly related to heart attack. Therefore, if in Indian population, if the waist circumference in males is more than 90 centimeters and in females more than 80 centimeters, then they are prone to heart attack. Therefore, one should be very careful about increasing waistline. Then I would also say that, let's say if a person has, despite doing all this, has developed heart disease, then what to do? He should consult his doctor, take the medicines regularly as prescribed, report to the doctor if he has got some side effects due to medicines. Don't stop the medicines on your own. Don't pick and choose the medicines. Go and report to the doctor. There are plenty of medicines available. If one doesn't suit, the other will surely suit you. Same is true of high blood pressure, that you should take medicines regularly, not that once it is prescribed, you sit back home and continue taking that medicine. Because as the age advances, the blood pressure rises and the need for medicines also improves. If a person has got a heart attack and has undergone some procedure like angiography followed by stenting, then the person has to take medicines. Sometimes they have to be taken for lifelong. If the person needs a bypass surgery, then the person after bypass surgery, after a few months, he is fit to go back to his work, and he should be leading an active lifestyle. Not that if you have got a heart disease or if you have got bypass surgery done or stenting done, that you sit back at home. We want that you should be active and work as you were doing earlier. So my message to you would be that if you take care of your heart, the heart will take care of you. Thank you.